I'm going to explain to you why infants throw up or regurgitate. I'm going to draw a picture of an adult esophagus, and that's a tube that goes between your mouth and your stomach. It's about 20 centimeters long, almost about 3/4 of a foot, and it goes into the stomach. And basically the esophagus gets food past your heart and your lungs into your stomach from your mouth. We also have a valve here that lets the food go from the esophagus into the stomach, but it prevents the food from going from the stomach into the esophagus. When I actually put, as a gut doctor, I sometimes put scopes down there. And when I do that, I notice that the esophagus is about this wide and about that long. Now, I don't regurgitate and I don't throw up, but it's a different thing in babies. What they have is a short esophagus, and their valve is weak compared to an adult, and it takes about 8 to 12 months for that valve to mature. Moreover, what happens is their esophagus is about this wide and about that long. So if some food comes up into the esophagus, it comes out their mouth. Whereas in me, if I have some regurgitation into my esophagus, it's got such a long way to go to my mouth that it very rarely does that. So this causes spit up in children. Now, what can you do about it? Well, the most important thing is time. Time will heal it, because as you get older, this gets proportionally longer, and the weak valve becomes strong. So with time, usually by a year, sometimes 2 years, and even in some 3 years, it improves. We can use some medicines, and the medicines we use are medicines to get rid of acid, and that tends to be drugs such as ranitidine or Zantac, or it can be Prevacid or Lansoprazole, it can be Nexium, and what that does is it gets rid of the acid. The other medicine we can use is a motility agent to try and get that stomach to push harder to get the food into the intestine and maybe even tighten up that valve. And we call those domperidone, or sometimes you can use metoclopramide. Now, to be quite honest, those things don't work very well. And I would say probably only work maybe 20% of the time. So it's very important that if they don't work, you can try them for a week or two. If they don't work, they're not going to work. The other thing is if they work, then remember, time will heal things, so you have to stop it. The other thing we can do is surgery, and really surgery is so rarely performed in the infant for reflux, at least in the normal infant, because what happens is we change that child forever. And we know that time is going to heal it. So really we don't think about surgery. The main thing is time. We also think about trying to keep the child upright after meals. Sometimes we can use formulas that are thickening, but the message is, give it time, it's going to get better.